Here are the top 10 questions that I hear from patients regarding the after surgery period following a total knee replacement, along with my answers to these questions. How long does recovery take? Here's a quick overview of the recovery process following surgery. So following surgery, you'll be transferred to the orthopedic floor of the hospital, where you'll be seen by both the physical and occupational therapists. The physical therapist will help get you up and out of bed to start walking within a couple hours of your surgery. Depending on how you progress, you'll either be discharged home on the same day as your surgery, or you'll stay for one night in hospital and then be discharged the next day. Most people walk with either a walker or a cane for the first 1 to 2 weeks after surgery. Full recovery typically takes about 3 to 6 months. However, most patients are back to their regular day-to-day exercises and routines within about 3 to 4 weeks after surgery. Will I need physical therapy? Yes, absolutely. Post-operative rehab and physical therapy is a key part to your recovery. Physical therapy starts almost immediately after surgery. For the first 2 weeks after surgery, we'll arrange for home health service to come to your home to start your initial therapy. Your first post-operative visit is back at clinic 2 weeks post-operatively, and that's when we'll typically start outpatient physical therapy. As part of your post-operative recovery, you'll receive a structured physical therapy plan with specific timelines and goals as you progress through each phase in your recovery timeline. How long will I stay in hospital? So many patients go home the same day as their surgery. Some patients choose to stay one night in hospital and then be discharged the following day after surgery. When can I drive again? So the two prerequisites to being able to drive after a total knee replacement are: number one, you need to be off all of your pain medications, and two, being able to walk without a limp. This typically occurs within about 2 to 4 weeks after surgery, but can oftentimes be sooner. When can I go back to work? So if your job is sedentary, you may return to work within about 1 to 2 weeks. Physically demanding jobs may require a little bit more time off. What restrictions will I have after a total knee replacement? Can I kneel or squat afterward? The short answer to this question is none. You can go back to whatever exercises or activities you prefer and enjoy after a total knee replacement. This includes skiing, golfing, tennis or pickleball, riding a bicycle, swimming, yoga, Pilates, and lifting weights. There will be no restrictions on what you're able to do after a TKA, and you will be able to kneel or squat. Will I set off the metal detector at the airport? This question comes up a lot, and the answer is sometimes, depending on the metal detector. If it does go off, you can simply tell one of the people at the airport about your total knee. They might scan it again, but it certainly won't cause any problems at the airport. Can I use stairs after surgery? The answer is yes, but usually with some assistance at first. Most patients resume normal unassisted stair use in about a few weeks after surgery. Are there things that I shouldn't do after surgery? We typically ask you to avoid high-impact sports like running or jumping, but walking, biking, swimming, and golf are encouraged after a total knee replacement. How can I make recovery easier? Stay active, follow your rehab plan, eat well, avoid smoking, set realistic goals, don't rush the process, and keep on top of your post-operative rehab plan. Go to physical therapy as much as possible. Do I need to take antibiotics for future dental procedures and teeth cleaning? No, and this question comes up a lot. There has been a shift in the recommendation regarding antibiotic prophylaxis for dental procedures in patients with joint replacements. The current recommendation is that routine antibiotic use is generally no longer recommended for most patients with prosthetic joints undergoing dental procedures to prevent prosthetic joint infection. The ADA and the American Association of Orthopedic Surgeons previously recommended antibiotic prophylaxis, but changed their stance based on evidence suggesting that it's no longer necessary and could contribute to antibiotic resistance. When can I bath or shower after a total knee replacement? You can shower right away. You'll be given a waterproof dressing immediately after your surgery to cover your incision. I tell patients to shower regularly and wash gently around the knee and incision with regular soap and water. In terms of submersing the knee in a bath, swimming pool, or hot tub, we like patients to avoid this until the incision is completely healed. This typically occurs about 3 to 4 weeks after surgery. This is done to help prevent a wound infection. So this brings this series of questions around total knee replacements to a close. Again, we broke this series up into 3 sections: before surgery, during surgery, and after surgery. We've tried to answer all or most of the common questions that come up, but if we've missed anything, certainly write it in the comments and we'll try to answer as many of these as we can.